UBC, inspiring Uganda.
Hello viewers, welcome to the program Safe Life. I am Kathy Ishimwe, and today we are going to be discussing occupational health with Dr. Sechimpi Kaheru Deogracius from OSHFA. You're most welcome. Please say hello to the viewers.
Hello viewers, I'm glad to be here to discuss about OSHFA Limited and occupational health.
Okay, straight up, what is the role of occupational health?
Occupational health is concerned with promoting the health and safety of working people. And it is not meant to be an end in itself. It is meant to increase productivity of working people. As you know, work, it is work which produces wealth. It is work which produces food. It is work which allows people to do various economic activities. So when we deal with the occupational health, we are saying whoever is doing some work towards the end of improving the welfare of people, improving the economy of the country, should be as healthy as possible so that they are as productive as possible, and therefore they contribute to development either of the individual worker, the family of the worker or the employee, the community in which they live, the company or organization they work for, and ultimately that is what contributes to what we call the economy. That work of the individual aggregated is equal to the economy of any country.
Okay. Are healthcare assessments mandatory?
Well, that is a debatable thing. Legally, yes. But to say that would be, how do you define a worker in the Ugandan context? But there is also the international context, but there is also the individual context. Because going by the natural law, which one would say God's law, people are supposed to be working to be able to eat. And this is repeated even by St. Paul when he said, if you don't work, you don't eat. But also, when God was creating man, he also said, you know, you go work and subjugate the earth so that you prosper. So that means work is a command by God, by various religions, but also when we come into communities, in every family, people must work. Because if they don't work, they will not eat. In fact, Julius Nyerere, when he was president of Tanzania, he used to say uhuru na kazi. What it meant that if you have to get independence and freedom, that means it is freedom to work. So what he used to say, that if you are a visitor in Tanzania in those days, first day you are a visitor, the second day you are learning the environment, third day you get a hoe to go and work.
Okay.
And so the same thing even here. Yeah, because in Uganda it is the same thing. People are expected to be working in their fields, on the roads, in offices and so on. So if you don't go to do your usual work, you are either sick or somebody is sick or you have some problem. Okay. Yeah, so in other words, work is embodied in daily living, and occupational health and safety is supposed to optimize that by making sure that people are healthy and able to do work, to produce goods and services, and therefore to make the economy grow.
Well, in case a worker is injured on job, what do you think should be done? Or what are we entitled to as workers?
First of all, as a worker or even if you are employed or not employed, work is not meant to injure you.
Okay.
Work, as I have put it, is meant to be able to make you earn a living.
Sure.
So, first and foremost, therefore, is when you are a working person, whether you are self-employed or whether you are employed by somebody, the most important thing is for you to remain at work. And that means all must be done to make sure that you don't get injured or you don't get sick. But if you do, then you should be looked after as fast as possible so that you can get back to work. Now, so we are saying injury should not be part of work. But if it does become part of work, then you should be looked after. And in the stages, the first thing is, if you get injured, then you should have first aid.
Okay.
Now, first aid is to try and minimize the effect of the injury.
Okay.
So, and of course, the effects of injury can be as simple as a cut, or as simple as losing your clothes or something, but it could also be as serious as your death, which we do not want to happen. So, the most important thing about injury is prevention.
Okay.
But if you get injured, treatment, and then you recover. And after you have recovered, we would want you to come back to work as quickly as possible.
Okay.
Now, if you are employed by somebody, if you are employed by somebody or by an organization and so on, you are expected to be treated, and then after treatment, depending on how long you have been away, you may need to be compensated. But for us in occupational health, that compensation and rehabilitation comes as a very, 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 very last objective.
Okay.
The main thing is, how do you remain as healthy as possible?
Okay.
How do you minimize possibility of injury? If you are injured, how do you minimize the effect of injury? If you are injured, how do you limit the number of days you are away from work? Because as God gave the order, go work and conquer the earth. So we wouldn't want you to remain away from work.
Okay.
Now, of course, we are going into the issue of workers' compensation. Now, the workers' compensation is governed by a law called the Workers' Compensation Act of 2000. I think that is the one which is still working, 2000. And there are rates based on the law. But of course, the challenge with that law is that it is prescriptive, and it only prescribes what they can see. But then some injuries are not so obvious, so that they are not even appearing in that law. However, what happened is that at the time, there is a provision that if the injury or the disease which is being talked about, which you have acquired from work, is not in the book, but you can scientifically prove that the injury or the disease was caused by work, then you will be assessed for that injury or for that work.
Okay.
Yeah.
So how is the employee and how is an employee's health information kept confidential? I believe here and there we normally have different complications. Some may come from the working environment. How am I sure that my information is not out there for everybody?
Well, that one now goes into what we call medical ethics.
Okay.
Now, in medical ethics, there is confidentiality. However, in occupational health, there are different levels of confidentiality. The first one is what we call the doctor-patient confidentiality, because your information should be yours.
Sure.
However, in some cases, the employer needs to know that you were injured, and especially if you have been injured at work, in fact, it will be the employer to send you to the doctor. So it is already public knowledge and in the workplace that you are injured at work. So in that case, if it is something which will affect the work, the employer needs to know.
Okay.
Besides, but of course you will not get the details of how much you were treated and so on, but he knows you were injured at work. Now there is another set of ethical consideration if your health or your injury, because in this case the injury can be either an injury which is like being cut or something, but also a disease. If it is going to affect other workers, then there is a way in which the other workers must be protected.
Okay.
If you have an infection like TB and so on, they may not tell everybody you have TB, but they will say, you know what, for this period of time, you have to be away from work, so that the other people are protected. Then there may be another level, the fourth level of the community. Now, you know about Ebola, you have heard about COVID and so on. Now, if you have Ebola as a worker, like a health worker, then you have to protect the community. So in that case, you say we have cases of Ebola, and some of them have been here working here, so we need to protect people, the public. And in that case, you will go ahead not mentioning that the person is sick. The person, you may not even initially give the information unless they have permission, but you say we have a case of Ebola here, and we have got to quarantine the place and so on. So those are the 4 different levels of ethics in terms of health and safety at work. Because you protect the individual, you protect the employer, you protect the co-workers, and you have to protect the community.
Okay. Well, talking about mental health, do employers have to provide mental health support to their workers?
Well, health is complete physical, social, and mental well-being of workers in all occupations. So that means mental health is part of it. But the other part, which is also not always talked about, is the social bit of health. Because the social is like interpersonal relationship. It is, it could be employer-employee. It could be between employers and between employees. And it could be between the employees and the community. Now, those are also aspects of health which are rarely talked about. Because if you have a workplace and people are throwing things into the community and they are beating people outside the community, I mean outside the factory or the workplace, they are affecting the social well-being of the neighbors. And that is as much occupational health as if it was inside the workplace. So that's why in terms of health and safety, we talk sometimes of health, safety, and environment, because you are not only concerned with the environment inside the workplace, but you're also concerned with the environment outside, including the people and the environment outside. So much so that in some cases we say you might be protected from the environment at work, and then what you have been protected against in the workplace, you go and you get it because you did not control it by its going outside. Or the children or the wives or whatever, the members of the community outside are affected, and then you also get affected by what you were protected against in the workplace. So that is now like the continuity of the environment. So sometimes you will hear health and safety and the environment. It is for that reason.
Okay. So how do you see the health care of working people in Uganda?
The health care of the working people in Uganda as I said, it is in a continuum. So you must begin with what we call health promotion. That is where you make sure that the people are as healthy as possible by eating well, by sleeping enough, and so on and so forth. You are preventing hazards like smoking and so on. That is health promotion. You are having exercise and so on. And all those things can be done in the workplace. So for us, that is the thing we would promote most, the health promotion. And as Jesus said, he said, I came to give life, and to give a life and give it in abundance. And that's what working people are entitled to. So promoting their health. Then prevention. Now, you will have hazards in the workplace, and if you know them, you try to prevent them. You do risk assessment, and you say this one is likely to happen, this is likely to be there, then you prevent. Then the third aspect is early detection of departure from health through medical examinations and so on, and also monitoring the working environment. And then if somebody falls sick or gets injured, you treat them. And lastly, you go to rehabilitation if somebody has been injured. Because as I said, you'd want them to be back as well to the workplace as soon as possible. And to do that, you rehabilitate the people as soon as possible so that they get back to work. But if they have lost something, then there is something beyond that, which is called occupational therapy. You may have to rehabilitate them to be able to get back to work faster. Or if they have had a mental health problem, you rehabilitate them so that they are back and they are working as normally as possible. That is rehabilitation. So that is the spectrum of the health and safety as it should be. So it is not just first aid, it is not only about people, personal protective equipment. It is that range of the package which is supposed to be there so that people remain as healthy as possible, preferably by not falling sick at all and so on. But if they fall sick, as I said, or if they get hazards, you prevent them. If they get injured, you rehabilitate them as quickly as possible, treat them, rehabilitate them, then they get back to work as quickly as possible.
Okay. Well, how do you stay informed on the current healthcare advancements for workers?
Now, as a doctor, we are permanent students. Okay. You have to be a permanent student, learning from your patients, learning from your colleagues, learning from internet, reading books, doing research about something you have found which is uncommon, and then you share with others. So as a medical doctor and maybe as other professionals in the health and safety area, you have to be a lifelong student because the working environment is always changing. There are not workplaces which have similar situations. If it is similar building, there will be different people. Sure. There will be different circumstances. So you have to be open-minded, always knowing that there is always, the frontier of knowledge is always extending, and you have to keep pace with that.
Okay. Well, how does OSHFA feature in this?
OSHFA Limited, OSHFA is an organization now which is a company which provides occupational health care in the way we have described it. So anything health in the workplace, we'll deal with it. Okay. So irrespective of which job you are doing, which working environment you are in, we can always come in to give advice, to promote health there, and to make sure that the people remain as healthy as possible as they work and they earn a living.
Okay. Apart from promoting health, are there some other activities that OSHFA handles?
Well, they will be in that spectrum, because it is the people, it is the working environment, it is maybe the legal system, laws working within the law, yeah, and so on, yeah.
Okay. So what are some of the achievements that you look at from the time you started up to today?
Now, Oshfa Limited is a company which has been around for some years. Real operations started maybe around 1995, so that is about 30 years now, 30 something years. And okay, apart from treating people when necessary, we go into workplaces to look at the working environment and relate it to the work people are doing, and then advise people.
Okay.
But also, we do environment impact assessments, environmental audits of the workplaces to see how well the working environment is suited to the people, and how well are people suited to the working environment, and we try to balance the two, all aimed at improving the productivity of the individual, the productivity of the company or organization, and that means, of course, contributing to the economic productivity of the country. Okay, we also do assessments for medicals, pre-employment medicals, post-injury assessments, medical assessments, workers' compensation assessments, and any other requirements if it needs intervention, medical intervention.
There are some challenges that you face along the way. Would you please mention some of those challenges that you
The challenges would be mainly, if you can call it a business, as a business, it is always challenging. Because most people assume that healthcare should be free.
Yeah.
And of course,
Sure.
it is never free. Somebody must pay.
Sure.
Either the government pays, or a company pays, or the individual pays. But also, as I put it, if you want to remain healthy, then you do the health promotion bit. So we would advise people to remain as healthy as possible, so that they don't come to the doctor, preferably, which would put us out of business. But even there, we can give you advice how to improve, even to do better. Yeah.
What could be your future plans as OSHFA?
Well, we are available for people who are willing to espouse us, to give them advice, to give them the services. In addition to those, we also provide, for example, personal protective equipment and equipment which may be used to measuring the working environment and so on. So that depends. If you are interested, you will always come to us and we'll give you advice in any of those areas, whether it is to do with the working environment, or how you improve the work itself, or how you improve the health of the working people in your organization. Yeah.
Well, as we are coming to the end, what is your appeal to the public, the general public, to the government, and to the stakeholders?
Okay, the appeal will be, as you have put it, at various levels. For the individual worker, so it is not that you will be employed by somebody. Even if you are self-employed, if you are a farmer on your farm, if you are a carpenter in your workshop, if you are running a clinic of your own and so on, the most important thing for you is to remain healthy, so that you can be able to earn a living for yourself, for your family, and in the end help the country. So we can give you advice on that if you need it. Now, as for companies, we have also mentioned what you need to do. You come to us, we'll look at your workplace, we'll give you advice accordingly. For the governments, we can still give advice, but also, as I mentioned it maybe earlier to you, we have got NGOs which can help, particularly Uganda National Association of Community and Occupational Health, of which I'm part. And we do work with the government to educate people generally and so on. But when it comes to individual workplaces, it is a lot easier to work through a business model, because that is maybe easier to appreciate, because as an NGO, it is a bit more difficult to provide a free service, because this is a bit more complex, what we are providing. But giving knowledge and so on, we can do it through NGOs, or you can invite us to come and talk to you. And like we are doing now, well, that one we could do gratis, but when it comes to the nitty-gritty, I think it is worthwhile for people to part with something.
Okay. Well, in case someone would like maybe more information, or maybe could you please leave maybe your location, a contact that you could be contacted through?
Yeah.
Someone would like more
Okay, I'm
information
in
about
YMCA. Washfa is located in YMCA building, and I can leave my telephone contact at 0772 451 641. We have a website which is Oshfa, www.oshfa.co.ug. And if you want to send us a message, it is info@oshfa, OSFHA. It is not without an I in between. Oshfa, OSHFA.co.ug. And what else? The email. Yeah, okay. The personal email is dsekimpi@gmail.com.
It was really nice having you on the show, Dr. Sechimpi.
Thank you very much.
Well, we'll be glad to have you again on the show. Well,
Anytime.
Well, thank you so much for staying with us throughout the show, and this mainly goes to the different companies out there. Try to create a conducive environment for your workers. And please remember, living a safe life is your right and responsibility. I remain Kathy Ishimi.